Recording in.
I think we can start.
All right, ma. Good evening, everyone. Good day and good morning from different time zones that we are. All right, so we are welcome to this webinar. My name is Akintayo John, and I am here with PT Clara Ezekwibe. She's the speaker for this webinar. And so why are we here? We are here because of the Fall Prevention Awareness Week, which is between September 23rd to 27th. So in the next few minutes, we will educate ourselves. We will be educated to the speaker on assessment of fall risks in older adults, a strategy for promoting healthy aging and longevity. So without any further ado, I will hand over to the speaker, PT Clara Ezekwibe. Over to you, ma.
Okay. Good evening, everyone.
Good evening, ma.
Good morning, good afternoon, wherever you're joining us. So today, I will be sharing my screen, and today we'll be talking on assessment of fall risks in older adults, a strategy for healthy aging and longevity. Please, can you see my screen? I need to be sure. Am I sharing my screen?
Yes, we can see it, ma.
Okay. So we'll be discussing about assessment of fall risks in older adults, a strategy for promoting healthy aging and longevity. Clara Ezekwibe, I'm a physiotherapist, and I'm also a gerontology master's student at Virginia Commonwealth University, Richmond, USA. The reason why we have this webinar is we want to educate ourselves on fall. This is the Fall Awareness Week. Fall is the 5th leading cause of hospitalization and death among older adults. And when we say older adults, we're talking people 65 years and above. And there is this belief that fall is a normal part of aging. Oh, this person is an older adult, he fell. So people believe that if you're an older adult, that is, if you're 65 years and above, you should fall, or even when you fall, it's not a big deal. That's wrong. Fall is not a normal part of aging. There is no genetic, psychological, or physical changes that occurs in the body that states that fall is one of it. Another fact is most falls that occurs in older adults are preventable, because these are things that we need to educate the older adults, the caregivers, even the organizations that are called to it. And this is the most interesting thing. According to the United Nations, by a report made by them by 2015, that's in 25 years from now, 1 in 6 people will be aged 65 years and above or and older. So it means that the world is gradually aging. We are in a season, or we are in a phase in the world. It's not just about Nigeria, it's not just about Africa, it's not just about Europe, America, Asia, the Pacific. It's not about that. It affects everyone. It affects every region. It affects regardless of tribe, place. So we are in a system where we could say that the world is aging. The world has never experienced this form of aging before. So it's more like currently there is a transition. So by 2050, which is in 25 years from now, 1 in 6 people will be aged 65 years and above, which means that by 2050, 21% of the world's population, that is more than at least about 1/4 of the world's population, will be 65 years and above. So that's what it means. If you're currently 40, by 2050, you should be an older adult. So this is statistics. Statistics shows that in a year, about 30% of older adults globally in the world fall in a year. So yearly, which has sometimes the statistic is between 26 to 40. So we'll see that between 26 to 40, 26 to 30, rather, pardon me for that, older adults, they fall each year, and these falls are preventable, they can be prevented. And 40% of these fall result in long-term care, hospitalization, and other form of management. Also, 30 to 50% of older adults that experience fall have a tendency of recurring fall. So once somebody experience, research has shown that even once an older adult experiences fall, the tendency of them experiencing fall the subsequent years increases by about 30 to 50% because of the initial fall. And what is fall? The World Health Organization defines fall as an event that results in a position that an event that results in a person coming to rest inadvertently on the floor or the ground or at a lower level. That's just the definition of fall. So when a person moves from a position to a lower level, this is called fall. Now we need to know what are the risk factors. What are those things that predisposes older adults? Why are older adults the predominant population that we are more focused on that they shouldn't experience fall? That is because the risk factors that predisposes the older adult to fall are the intrinsic and the extrinsic risk factors. And in the intrinsic, we talk about the patients, that's the older adults, their characteristics. And that is where we talk about the changes in the aging process, changes in their bones, changes in their muscles, the changes in the body system, and the things that occurs in the body system. These changes predisposes older adults. The next we talk about medication. Most older adults are in what we call polypharmacy. So they are taking so many drugs. They are taking drugs for osteoarthritis. They're taking drugs. They are taking diabetic drugs. They are taking drugs for hypertension. They are taking drugs for so many conditions. This predisposes older adults. This is comorbidity. So most older adults have multiple conditions at the same time. Then when we talk of the extrinsic factors, we talk about their environment. The environment of an older adult predisposes them. How is the environment? Is it accessible to them as an older adult? Is it enabling them use assistive device? Then what are the help they have as older adults to help them? So to just break this risk factor down for you, we have, this is to make it simpler. This is basically a mixture of both the intrinsic and the extrinsic factor. And when we talk about the reduced musculoskeletal flexibility, we are talking about the changes in their body, maybe the pain, and then polypharmacy. This comes in even in their intrinsic factor. Then limited knowledge on fall prevention comes in their extrinsic factor, because most older adults are not aware that they have a tendency for fall, or because of the changes that occurs in their body, they have a tendency for their joints to not be they have tendency for the changes in their joint. So this older adult, because of the limited knowledge, predisposes them. And of course, we have the musculoskeletal weakness and then the vestibular function. This vestibular function, mostly healthcare professionals will be aware of this. The vestibulocochlear part part is a part of the inner ear that helps us in balance. So when this is affected, or even the proprioceptive defects, when these are affected, it predisposes an older adult to fall, or the older adult general to fall. And what are the consequences of fall? We are speaking about it because the consequences of fall is so much. It has the physical consequences, the social, the psychological, the governmental, and this is even more in developed countries where part of the healthcare coverage is funded by the government or by trust or by the health insurance system. Then of course the economic. In the physical, this was just hip fracture, but it's not just about hip fracture. They will come to fracture, they will come to dislocation, and other condition. Then we also have immobility. This is also one of the physical effects of fall. Fracture could lead them to immobility and then pain, discomfort. In the economic factor, because of fall, there is fracture, and if there is fracture, they will have to pay for hospitalization, hospital bill, hospital treatment. This increases the cost of aging. And do not forget that most older adults are either officially out of work or they are still employed in a self-employment scheme. So this increases the cost of aging. Then in the social effects or consequences of fall, they can be changed in their routine because of the fall, or maybe because they are being hospitalized. They may not have the opportunity to engage in their daily activities anymore, and they may not have the opportunity to engage maybe in the social activity, the lost independence. They are either wheelchair bound or bounded in the home or the nursing care facility or residential home. So it has a lot of effect. And then on the psychological aspect, so most times we believe that, okay, you're falling, it's okay, just stay in that particular place. But it's frustrating. It's frustrating to know that you used to move, or maybe as of last week ago, you were moving on your own, or maybe with your walking stick, and then for this week you can no longer move out, you can no longer walk. So there is frustration, depression, low self-esteem. This affects the older adult. And of course, the governmental aspect, this is usually find more where the government plays an important role in providing health coverage for older adults or for the citizen. So the government have to pay more of, cater for more of this health coverage or of the consequences of fall itself. So we'll go down to how then do we assess fall? Now, I wanted to know something. In the assessment of fall, for older adults, let's go first. For older adults, we play an important role. The healthcare providers, the caregivers, the older adults themselves, the community programs or community organizations, the nursing care staffs, the residential home, we are all, it is a multidisciplinary approach. We all have a part to play in the assessment and prevention of fall in older adults. So it is not just about their healthcare professionals. You are either for caregivers, you can either be a former or an informal caregiver. So you're either living with your mom, your grandparents, a cousin, a relative who may be an older adult. And that is why caregivers, the part where caregivers comes in, it's very important. The older adults themselves, they also have a role to play in the prevention of fall, and the community members. So in saying this, now we'll go down to what are the validated fall assessment tool. For us to know that this older adult has a high risk of fall, we have to assess them. Now, generally, all older adults have high risks of fall because of their intrinsic and the extrinsic factors that predisposes them to fall. This is something that as the age, it comes with aging. I usually call it just the blessing of aging, the changes that occurs in the biological, physical, and social body, right? But we now need to be aware, or we now need to know, how can we say that this older adult is at higher risk than the next older adult, or this person A is at higher risk than the second person, because even though they all have a generic risk factor, there are still things that changes or predisposes one person to the other. The first could be maybe their environment or the particular body nature, or even female, because the female older adult, because of osteoporosis, the changes in the estrogen level that affects the bone. So women are even predisposed more to fall. So when we are talking about what are the validated fall assessment tool, this is very important, especially for healthcare practitioners and for nursing home staffs, or even the community services too, because these are tools that have been tested. They have been shown to, they can validate, they can help you know, okay, this older adult one is at higher risk, and they now provide what are the ways we can sit it or we can manage it. The first is the fall risk assessment tool, the birth balance, and then the balance outcome measures for elder rehabilitation. And there are a lot of assessment tools available, but different facilities, different organizations, it is important that you pick one or two to stick to it, or even change. You could assess among your older adults and know which of them would you use? And I also like to say this for healthcare practitioners. Of course, when a patient comes to the hospital, there is you carry out vital signs, you do those things. I would like to encourage healthcare practitioners or nursing home residents that are here. It is important that we carry out a full assessment tool or a full assessment rather using any standardized tool to assess the full risks of an older adult. It should just be part of our vital signs too. Because when you have an older adult, when you run a clinic, a hospital, a facility, or even for an educative instructor, maybe an adult trainer or something, you can learn how to use these validated tools. They are not so difficult to use. They are usually in the form of questionnaire. We have a sample here. This is the FRAX, the 4 weeks assessment tool. It is a questionnaire. When we look down, we'll see when was the last time you had a fall, the last 12 months, the last between 3 to 12 months. So you tick, you grade. Then what are the medications that an older adult take? We tick, we grade. What are the psychological effects? This is just one to show us that it is important for us to assess the risks of older adults. When they come to our facility, our engagement, it is very important that we look into the assessment of it. And when we assess it, we see that this older adult has a higher risk, then it's now a time for call to action. It's now a time for us to now look into and say, what do we do? Maybe as caregivers, as professionals that work with older adults, as nursing home staffs, as healthcare professionals, what do we now do? So it is important that we assess them using standardized tools. So you do not just say that, okay, he's an older adult, then his drugs, his medication, and then you assume. It is important because when we use standardized tools, they narrow it down to let us know what can predispose this person. Is it their medication? Is it their environment? In that way, we can derive a personal approach or a person-centered approach in their management. I already said before that the prevention strategies is a collective effort. We all put our efforts together. We all work. There is no one person that is given the responsibility of taking care of the older adults. It is all our collective effort because you will be an older adult one day. So if you're not taking care of yourself now, or if you're not rendering that service, or if you're not gaining the knowledge, the skill, with time, in few years time to come, you would also find yourself in this place. So it is important we maintain a approach. It's important that we maintain a multidisciplinary approach in management and in the strategies of fall prevention. Now, once we have assessed our older adults and we see that this person is at high risk, what do we do? What are the strategies we can put up? This is just a pictorial representation. You can encourage the older adult to engage in exercise, and this is where physiotherapy, physical therapy, or therapy comes in. Engage them because in aging, there is loss of muscle strength, there is changes, physical changes in the joint. So it is important that you encourage the older adults, you train them, or you refer them to a professional that would help them, which is usually the physiotherapist or the physical therapist, to assist them in exercise programs that will strengthen them, that will stimulate them. It is also important for us to encourage them to wear appropriate footwear, not footwear that would increase friction. So footwear that would enable them work properly, that will not predispose them to fall, and that they are comfortable in. Then it is also important to encourage these older adults, so when they are carrying out their activity, they should stand up slow. And this is because of hypotension. We have what we call orthostatic hypotension. So when a person is in either a sitting or a lying position and he just suddenly gets up, there is just this initial dizziness, there is just this initial drop in the blood pressure. So with older adults, there is an increase in the chances of orthostatic hypotension. So it is important for us as caregivers, as professionals, to encourage them. When you sit for long or when you are lying, it is important, mama, papa, you should gradually get up or change your position. And also, it is important for us to talk about how safe their homes are. And this is not just about their private home, even the residential home. or the nursing care or the nursing care home or the resident home, how safe are these homes? Do they have raise? Are there things, if there are stairs, how safe are the stairs? Are they too high? Are they too low? What are the things available? So it is important we keep this in check. And also medication. The medications of older adults are very important. Most older adults engage in polypharmacy. They take a lot of drugs, both the ones that are prescribed by a healthcare practitioners and the ones that are not prescribed, both the local, the herbal, and medications that are being prescribed. And so it is important, especially caregivers. It is important that as a caregiver, you look to the changes that occurs in your older, because the caregivers are the ones that stay directly to this older adult when they are at home or maybe when they're in nursing care facility. So it is important for you to know what are the changes that occurs. Are there a particular kind of drugs that this older adult take and maybe they sleep more or they feel tired more? So what are the changes? Because two older adults could be taking the same medication, but they're not having the same effect. The effect of one may be different from another. So it is important to know what are the changes that occurs when they take a particular kind of drugs. Do they give a report of feeling headache, feeling tired, feeling dizzy? These are very important for you to note so that you can refer them back to their healthcare practitioner or anybody around so that they will have a proper share. And finally, it is also important for them to see doctors, physiotherapists, their healthcare practitioner to ensure that whatever condition that they are managing or whatever things that they are that is currently ongoing in older adults, that it is put in check and there is no high risk for them to go on to it. Now, when we talk about the prevention plan, we need to know that prevention plan for an older adult has to be individualized. It has to be individualized. And that is why assessment for each older adult is very important. Assessment for fall, it is very important. We don't just assume that, okay, all of you, make sure that your house, there is no water, make sure that your staircase is not high. You don't just give a general prescription. It is important to individualize their prevention plan, maybe using an exercise program plan, a home modification plan, or even regular health review, 3 month plan, 6 month plan. So it is important as caregivers, as community dwellers, as members of non-governmental organizations, as healthcare practitioners, it is important that we individualize the fall prevention plan for an older adult. It is not a one fits all scheme. Each person has a plan. So when we carry out this assessment, we check on the plans and then we know, okay, what should we change? Is it the home? That is why home care modification comes in, or is it their diet? Is it the medications that they are taking? Or is it even their health? Is it even their psychological factor? Because psychology comes in. Some older adults, most older adults are depressed. They are going into depression, then dementia, Alzheimer's. So there's just a lot of mental health conditions that we need to also look into when we are factoring in the fall prevention plan. Because most older adults could be forgetful. They need you to constantly remind them that do not wear this kind of clothes or do not eat this kind of food. And that's what they deal with. That's just the changes that occurs with aging. And that is it. The next, as we round up, it is important for us to educate and train caregivers. Caregivers, both formal and informal caregivers, and the older adults themselves, but more on the caregivers and the older adults, because these older adults and caregivers spend the longest of time. So when the caregivers and older adults are properly aware, when they have the proper knowledge, then it becomes easy for them to prevent fall, it becomes easy for them to know these are the things that can predispose this older adult. Now we have technological innovations. There are wearable devices that helps to show alarm, that monitors an older adult's vitals, that maybe tells you, oh, your blood pressure is low, you are high risk of orthostatic hypertension or hearing aids or things that are loud in the body. So it is important that we use the technologies involved to assist the home. Even it could even be an alarm system at home to notify the environment or to notify the healthcare practitioners that this is what is at stake. And lastly, follow up. It is important to monitor and follow up the older adults as they come to you in your organization, in your hospitals, in your care, in your facilities, wherever you find yourself. It is important to follow them up because they could be at a lower risk this month, and in 3 months' time, because of the changes in their body, they are at a higher risk already. So when we monitor them, when we carry out follow-up schemes, when we carry out things to assess them, it becomes easy for us to know what are the changes. The changes that occurs in older adults. For some, it may be rapid. For others, it may be gradual. It is important for us to be aware so that we can easily assess them and put up the preventive strategies that are very necessary. So thank you so much for listening. We talk about healthy aging, we talk about longevity and fall. That is it. Thank you. I'll stop sharing.
All right. Thank you very much, Ma, for this wonderful presentation. I believe we could learn the causes, effects, prevention, and even the assessment of fall in older adults. Okay, the floor is open to us all. I don't know whether anyone have any contribution or questions that you might want to that need clarity on. So the floor is open. You can unmute yourself in the next 5 minutes, please.
Sorry, my eye wasn't on the message. My screen wasn't moving. Like the slide wasn't showing.
It wasn't moving.
Wow. So sorry about that. I guess we'll just have to, we can drop our emails, then we'll send out we can all drop our emails now so that we can just send out the slides across. I'm so sorry about that. I wasn't just paying attention to the chat. So sorry about that. We can drop down our emails. We'll have it all forwarded to everyone, please. So let's just go ahead.
Okay, so do we have anyone with any contribution or question for clarity in the next 5 minutes? The next 5 minutes. I'm sure we have older adults with us, or maybe we are health care practitioner, or we are even older adult ourselves. So is there anyone with any contribution? The floor is open for any question or any contribution. Okay, the time is counting. Any question, or you want to add anything, want to clarify, you have any question? From anyone? Or you can even tell us what you actually learned from this webinar that have added value to you in as a caregiver, health practitioner, as an older adult, as an adult educator. Okay, there is a question here, ma. There's a question here from, okay, the question is that from Mr. Ajayi Anthony. What home adjustment do you recommend for elderly homes?
Okay, let me quickly answer that. For elderly home, part of the home.
Hear this question, Mr.
Yes, can you hear me?
All right, yes, you can hear you now.
For elderly home, part of the home adjustments that should be made in home is there is a need to install hand rails and grabs like hand rails in the house. Whether it's, especially if it's a home that is maybe a story building, hand rails for older adults to have something they can hold on to as they are moving. Most older adults, even when they have an assisted an assistive device, maybe their walking aid or anything, they may not use it. So when there are hand raised at home, it is important, it helps them to have something that they can grab as they are walking through the parlor or as they're walking into their room. That was the first. Next adjustment that can be made or in the home is it is important to improve lighting. Do not forget that the sights of older adults are, well, with age, sight, it's not something that is common for everybody, but most older adults with age, there is a decrease in sight. So it is important to ensure that lighting of the house is maximum. There is enough light. Then the floor, it is necessary that we take note of the floor. Is it tied? If it's tied, is it too slippery? So we can change it to maybe rug or other floor materials that is not so slippery, that will not predispose them to fall. Then I think these changes should improve, should adjust the home and then to make it better, especially the floor. The floor is very an important thing. So, and it is also important for us to make different rooms accessible, the places to the kitchen, to the then their bathtub, how is it? These are the things to put in check. If there are stairs, let the stairs not be too high or too low. It's better for it to be too low than it's too high, so they won't struggle in moving. I believe this answered the question. Thank you. Okay, we have someone else. Please, you can unmute yourself. Shade, I'm not sure I got that pronunciation, but please, you can unmute yourself.
Hello, doctor.
Yes, we can hear you, ma'am.
Hello?
We can hear you.
Okay, doctor. Okay. My question is, I'm over 60.
Okay.
And lately I noticed that when I wake up and or when I get up, if I was lying down and I just get up to pick something, I just feel dizzy.
Okay.
So is that normal or there's a problem?
When you're
That
lying,
is my question.
okay, ma.
Yeah.
When
You
you're
know,
lying, you get up.
even if I wasn't lying down, if I get up,
Get up.
if
Okay.
I was sitting down and I just get up, I have to quickly hold something. I'm
Yes.
63.
Okay. Okay. So there is something.
So I don't
Okay. There
go
is
ahead.
talk about the physical changes. First of all, have you monitored your blood pressure? Do you?
Yes, I'm on BP medication.
Okay. That is because research has shown that people as older adult, as they turn old, they are predisposed to a condition which we call orthostatic hypotension. It's just the very opposite of hypertension. Hypertension is when your BP is high. Hypotension is when there is this sudden drop in BP. And it usually occurs when someone changes position from sitting to standing or from lying to sitting. It occurs in every individual. When a person is sitting down and they suddenly get up, or when a person is lying down, they suddenly get up, automatically there is a like a 99% risk of orthostatic. It is called orthostatic hypotension. So there is just this drastically drop in the blood pressure, and I believe that is just what is causing that sudden dizziness. It even happens to me sometimes, especially when maybe I've been so stressed. Once I get that sign, I'm like, Clara, you're already being so stressed. So that is a clear sign of what we call orthostatic hypotension. So it's just important for you to gradually get up. There is a slide, there is a place in my slide. It's just so unfortunate that my slide wasn't moving through. There was a
It
picture there.
was not moving.
I'm so sorry, but I will send out once an email is here, we'll send it out. Where we say part of the prevention
Okay.
strategies is get up gradually. You can hold your share,
Okay.
gradually get up, because once you forcefully move, there is a drop that occurs in the blood pressure.
Oh,
It affects
okay.
everybody.
So it's normal. It's not nothing to fear about.
There's nothing to care
There's
about.
no cause for alarm.
Yes,
Okay.
become more conscious of it. It's not a medical
Okay.
condition. There is nothing. It has a name, orthostatic hypotension,
Okay.
and it occurs everyone,
Okay.
especially when you change position. So it's not a call for alarm. Thank you.
What do you call it? Stato what?
I would spell it orthostatic hypotension.
Okay.
So we'll just
Okay, spell it, please.
okay. So I think that should be the last. Jide, we're about rounding up.
Thank you very much.
All right. Good evening, therapist Clara. I believe I'm correct.
Yeah.
My name is Jide Alaji. I'm a physiotherapist. I'm so happy with what you've presented. I think there are a lot of takeaways from it. Let me start with the question the last contributor said, the madam that was speaking. Yes, the orthostatic hypotension, postural hypotension happens sometimes with people, especially as they are getting more elderly. But like she said, I want to add also, apart from the blood pressure measurements, it's good to also monitor the blood glucose levels to be sure there is no
Okay. Oh, so sorry about that. I don't know if the person answering the question is still here. Okay. The person answering the last question, are you still here? I think Jide, okay, he's still joining. So sorry for the no, he's still joining. I guess it's from his end. Sir, are you here? He's not.
Press your name.
I don't think he's here. Kindly ensure that your mic is muted. I don't think he's here, but it's very important. He mentioned an important aspect, which is the blood glucose level too. So it is also important for us to check.
Blood glucose level. Okay.
It's not here. Okay, you can continue, sir. I think this should be you. Please go ahead. You're the one answering the last question, giving us a contribution. Sai, can you unmute yourself? That Shade, I think. You can unmute yourself, Ma. Your hand is raised. Ma or Sam, sorry for maybe the preferred pronoun. You can unmute yourself and speak.
Can I go ahead?
Yes, please.
Yes, that I was trying to tell you that can you share your number so that I can talk to you much later?
Okay.
Because I'm an anemic person.
No.
So I'm anemic. Could that be it? Because most times when I'm feeling anemic, I'm on glucose according to the doctor. So I take glucose, or I just look for 7-Up or Sprite to take. But as I'm getting getting older, I'm still feeling it the more. So I really don't know. So that was why I get scared when I get up and I just feel dizzy or feel as if I want to fall. So when he was trying to now say that I should check my glucose, so I should just go to the hospital and make a see my doctor or what?
Yes, it is important for you to constantly check your glucose level. Glucose level, you could check maybe in the hospital or any, I think most very big pharmacy, but preferably it's better to go to the doctor.
Okay.
You may not have a doctor's appointment or anything, but you can just say, okay, you want to check your blood glucose level. And now that you mentioned you are an
Okay.
it is very important, especially for your
Okay.
blood level too. In anemia, it means that your blood level is low, usually low. Let me use that word.
Yes.
Below
Yes.
the percentage that is supposed to be. If it's supposed to be
Yes.
30,
I know so. I know so. Yes. Since I was younger, I know so. Okay. So I can go to any of these um pharmacy and just tell them it's different from checking your sugar level, or is it the same thing?
is your blood glucose level the same thing as your blood sugar level?
Okay. 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 Okay.
When the
Okay.
body breaks it, that's where it's got. So we can just constantly check it.
Okay.
But now that you've also given us a hint, these are the things that can make it usually hard. But when you monitor everything that is involved, and I think it just becomes better. You can now.
Okay. It's different from people that are suffering from diabetic. I'm sorry, I'm a layman person. So it's different because people with diabetic, their sugar level is high. Is that what we're saying?
Yes.
Okay, thank you. Thank you very much.
Okay.
That's all about it. Thank you. I'm grateful.
I just attached my number to the chat. You can just still reach out if you still
Okay,
feel like.
okay. I've forwarded my email address.
Okay, it's fine. So thank you, everyone. It's such an honor to have us here joining this webinar. I believe we gained something, one, two, helping us. And I'm so glad we also have another adult in our midst, or someone who is already above 60. It's very good. In that way, you are better informed. In that way, you are aware.
Yes.
This opportunity is also, this kind of webinar is also an opportunity for you to ask those silent questions that you may not really have the opportunity most times to ask the questions. So thank you very much, everyone, for joining us today. And if you're yet to send in your email, you can still do so as we are about ending this webinar. You can send in your email so that you have the slides and any potential material so that will have to help you. We'll be sure to attach it to the email. So okay, thank you, everyone. Thank you, Charity. So good night. We're in Nigeria, so good night, everyone. Thank you.
Good night, doctor. Thank you. Very enlightening. Thank you very much.
Okay.
Thank you.
Be sure to check your emails. Let me take everything.
Thank you. God bless you. Good night.
Good night. So bye. We're ending this chat now.